Food can heal. It can ease back pain and chest pain. Food can help headaches, heart disease, stomach disorders, osteoporosis, diabetes, and every form of cancer. For women, food can help menstrual cramps, bladder problems, and it can balance our hormones. Here to teach us a revolutionary approach to healing is my special guest, Dr. Neal Barnard, a leading pioneer in education about the healing power of diet. He is president of the Physicians Committee for Responsible Medicine and author of many books, including Foods for Life, Eat Right, Live Longer, and the best-selling book that we'll talk about today, Foods That Heal Pain. I welcome you, Dr. Barnard.
Thank you. It's great to be here.
Great to have you. When I started reading this book, I started thinking about the times in my life when food has profoundly helped me. In 1983, I had a car accident, and I had an inner ear imbalance, and a doctor at Lenox Hill Hospital was doing research on food, and he healed me through putting me on a diabetic diet, and it was fascinating. And then people in the office that were diagnosed with depression really had an allergy to sugar. It was really amazing what food can do for you.
We're learning more and more that food has power that we wouldn't have guessed, and often in ways that we wouldn't expect. For example, back pain. When I was a medical student in Washington, D.C., back almost 20 years ago, I'm sorry to say, people would come into the hospital for back surgery, and I'd had to do the preoperative exams, and I hated to do it because I knew that 6 months later they would come back worse and have repeated surgery. But we've learned some things about the causes of back pain. And in fact, can I show you a model of the back that I've brought along? The vertebral bodies, these bony vertebrae, are separated by discs, which are sort of leathery cushions. It degenerates, the disc degenerates, and the inside presses out, hits a nerve, that causes the pain. Well, for the most part, doctors haven't looked any further than that. They just take the disc out, fuse the bones together.
Right.
Well, we've looked into the arteries leading to the back, and we found that they are the first arteries to show the damage from a high-fat, high-cholesterol diet. In your heart, you get blockages of cholesterol and fat that lead to a heart attack. The same thing happens in the back, so that by age 20, 10% of Americans have one or more of the lumbar arteries completely sealed off. So what does that mean? It means that we pick up a box of books, or we dance the mambo a little too vigorously. We sleep on a soft mattress. The back has wear and tear every day. If you've sealed off the arteries that give it blood and oxygen and let it heal, it can't heal. And so we now believe that there's very good evidence that the best treatment for back pain is just the opposite of what we used to say. We don't take those discs out. We leave them in to the extent that we possibly can. Instead of bed rest, we keep people physically active, and we want to use the foods that are the best for opening up the arteries again, especially the vegetarian foods, grains, beans, vegetables, fruits, and avoiding the meats and so forth.
So this is like a heart diet, isn't it?
It's exactly a heart diet. Who would think that that would be useful for the back? But the best evidence we have is that ordinary back pain starts in the coronary, or not in the coronary arteries, in the arteries to the back, just like coronary heart disease, and the treatment should be very similar.
This is like the doctor you speak about in the book, Dr. Ornish, that did a survey.
Dean Ornish, yes.
Dean Ornish.
Really a brilliant researcher in the San Francisco Bay Area, who showed back in the early 1990s that you can actually not just prevent heart disease, you can reverse it. In 82% of patients within a year with no medicine, no surgery, but to do it, you've got to do a lot better than just switching from beef to chicken and taking the skin off the chicken. That doesn't lower your cholesterol level enough to change what happens in the arteries. So he used the vegetarian foods. So instead of the spaghetti Alfredo, we're going to have the marinara. Instead of the meat taco, we'll have the bean burrito and hold the cheese. And when you do that, something happens in the body that never happened before. And that is that the body will actually heal itself. The arteries start to open up again. And I don't care if you're 35 or 95. You can clear out accumulated blocked arteries if you change the diet and lifestyle enough.
This is breakthrough. This is absolutely amazing.
And we're applying it to anything that relates to blocked off arteries. Heart disease, stroke, back pain, even impotence in men. This wakes a few men up. It's really true. By age 60, 1 in 4 American men is impotent. They're all lined up for Viagra now. Well, the problem in most cases is a lack of blood flow. And just like if you block the arteries to the heart, you have a heart attack. If you block the arteries to the brain, you have a stroke. If you block the arteries to any vital organ, if you catch my drift, it doesn't work so well for men. So In fact, when I give lectures, I have a lot of young men lined up for my macho tofu recipes and
Right.
power brown rice. I'm kidding a little bit, but it's serious business. We have 4,000 heart attacks every day. That's just a sign of the bad shape that we tend to be in and the diets that have really kind of wrought havoc with our artery system.
But this is very optimistic, your research.
Oh yes,
I mean,
it's never, so far as we can tell, it is never too late to turn things around.
Incredible.
And you don't have to commit to an artery opening diet or any other kind of diet forever and ever and ever. If a person does this for, say, 8 weeks after experiencing chest pain and so forth, they'll find that they are using less and less medicine, ultimately none at all. The chest pain simply stops.
That's interesting. You say you get people off medicine. Well,
oh, yes.
Some people might not like your book. By the way, let me show you your book. This is the new book, Foods That Heal, That Fight Pain. I mean,
Yeah.
are
You mean the
people,
pharmaceutical industry may not like it, yes.
how are people reacting to this?
If you'd asked me that question 10 years ago, I think people would have been more skeptical. Now we have evidence of how foods work. And not just for something like back pain, but for, say, migraines. It was back in 1983 that researchers looked at people with migraines, especially kids. And it's a tragic thing to see a kid of 11 or 12 or 13 with migraines 3 times a week. And we're not talking about, oh, I'm a little tense today. It's a crushing, throbbing pain on half the head, accompanied by nausea and vomiting. These kids can't study, they can't read, they can't go to school. They're just in misery, basically, until the migraine goes away, and that can be a day and a half. What researchers found is that in many cases, foods triggered the migraines. The parents would notice it, the kids themselves would notice it. Every time I have chocolate, I have a headache. So what they did was they removed all the common triggers. There are about 12 of them. You take them, in fact, I call them the dirty dozen. You take them out of the diet, and the migraines are eliminated in more than 90% of the kids. Cured, never have another migraine. You can put the foods back into the diet, and you can compare them with a placebo, like 2 puddings, one of which has one of the trigger foods, the other doesn't. They look the same, they taste the same. You can over and over and over again trigger the migraines. And for the rest of your life, you have control over whether you'll have headaches again or not. And in fact, can I show you some of the triggers?
Please do.
Because they're going to surprise you.
Go ahead.
They're foods that people have every day. The number one, I'm sorry to say, is milk products. Number one. And number 2, I'm even sorrier to say, is chocolate. Chocolate products, citrus fruits, tomatoes, apples, oddly enough, onions, wheat products, nuts, eggs, bananas. Now, I should quickly say, not everybody is sensitive to all of them. You may have just 1 trigger or 2. And there's nothing unhealthy about wheat products or bananas or apples. And it's rather like if you've known somebody who's sensitive to strawberries, they might get a rash. But for other people, they're fine.
Right. You mentioned strawberries as helping prostate cancer.
Yeah, exactly.
See,
That's right.
So, right.
Yeah, exactly.
And
there's nothing unhealthy about any of these, or certainly not about the fruits and about the grains and so forth. But if you're sensitive to them, then you're going to want to avoid them. We've looked at people who have rheumatoid arthritis, and we found that the same triggers apply. Dairy is again number 1. Corn is number 2. But eggs, tomatoes. So what we'll do, we'll take all the triggers out of the diet, let the joints cool down for, it might take 10 days or something like that, 2 weeks. Then put the foods back in the diet, 1 at a time, every 2 days, and let's say we put tomatoes back in the diet. If they don't trigger a symptom, fine, you can keep them. Let's put wheat back in the diet and all the other foods. And whichever food triggers the symptoms, and most people have 2 or 3 or 4 that are their triggers, you're going to know it. Within about 48 hours, your joints will start hurting and start swelling up again. And then you leave those foods out, and we see the majority of people can improve, or in some cases even eliminate rheumatoid arthritis. I don't care if you've had it for 25 years.